Good morning and thank you for joining us. I'd like to begin today with a brief case update. I am very happy to announce that we still have no new cases, holding strong at 50 positive cases here in Lane County that we know about. At least 3,272 tests have come from Lane County to our various labs. I'm also happy to announce the fact that the majority of testing taking place in our county is coming from our two labs that are located here in Lane County at McKenzie-Willamette Hospital through their partnership with U of O and Peace Health. So great news on the testing front. Of our confirmed cases, we have no one in the hospital. We have 30 individual recovered. So that means that we have 18 people that we are monitoring right now for recovery. And I like to think about that as just 18 to go. So if we maintain no new cases, that's the number we're chipping away at, and we want to see that go down to zero as soon as possible. We still have 2 individuals who unfortunately passed away. In terms of announcements, going back to that testing piece, we would like to make it known for the public as well as our provider community that we do need to be doing more testing now, that we have increased our capacity locally, but we're not seeing the number of tests come in. We believe that's because our docs and our providers here in the community have been so judicious and so good about conserving those resources, but now we have entered into a phase at which we can process more tests. So if you are a provider, please consult with your local guideline or with the most recent guidelines that talk about that piece around testing for mild symptoms and having those conversations with your patients. And if you are a member of the public and experiencing some of those classic COVID symptoms, those mild symptoms, do feel empowered to call your provider and have that conversation about testing. We want to see that increase because, as I mentioned, we do have tests here locally that are not being utilized. So with that increased testing, we can get up to that benchmark that Dr. Ludke has set for us, which will help us not only know that we have the capacity here locally, but help the public health understanding about how the disease continues to move through our community and whether or not we have hotspots. In addition, we would just like to remind people that the ballots have been sent out, your voting ballots. You should expect to see those in the mail this week. We really want to encourage you to get those submitted back as soon as possible and to make your voice heard. Voting is still a critical part of our country and our local government, and we need your input on that process. Fortunately, here in Oregon, thanks to the fact that we were one of the first states to institute mail-in ballots, that you can do so from the comfort of your home and remain safe. So please do so. Also, I'd like to bring up the fact that these wonderful graphics that you see from time to time that I hold up, I don't make those. That we have a team of people. They're actually called the Quality Compliance Division within Health and Human Services, who their entire function is looking at data and making up those graphs. We also, within our Joint Information System, our command center, we have an individual who works on those. So just want to make that clear that I am not a math wizard and I rely on other people to come up with those numbers for me. At this time, I'll take any questions from members of the media.
Jason, is there a place online where people can see that data?
Yes. So the question is there a place online where people can see that data? There is. If you go to our website at lanecountyor.gov/coronavirus, that is our coronavirus website, which I think we notified people heavily at the beginning of the outbreak, but we haven't circled back on, so that's a good point. And then right there on the front page, there's sort of a rectangle that's supposed to be a button. You hit that, and that will take you to all of our data that we've listed out. It has our epi curve on there, it has our new cases. We break it down by demographic to some level, and hopefully that will provide a level of understanding for our public. Another point on that piece that I would just like to call out is that I've mentioned this dashboard that we're working on with those key indicators, and so that process is still happening. We're trying to get that up and running for you, and that's why I've been kind of touching on some of the indicators that we have within our reopening plan. Like PPE, we talked about the exact numbers yesterday and the fact that we are in the green on PPE. There's still some planning that needs to happen on that, and there's some back-end technical work that needs to happen to make that dashboard reality. Until that happens, I'm going to be just sharing that information as often as I can via these press conferences.
James from KRE would like to know what the current timeline is for the 18 people at home to be considered recovered.
So the question is from James at KORE Radio. He asked what the timeline is on those 18 to go folks, the people that are still recovering with COVID at home, what the timeline is for them. So our last onset date of our 50th case, our most recent case, was on April 17th, and so we're looking forward out, considering the fact that we're around 19.6 days on an average case length for the duration of symptoms. We would be looking at early May for recovery on that individual, and that would put us, if we don't get any new cases, at that 0 mark. So that's kind of what we're looking at. Again, that really depends on no new cases being identified, and with that encouragement that we do more testing, we do expect to see more cases roll in. Hopefully, though, what we do keep is that the numbers of those severe cases at our local hospitals are kept at a reasonable rate or non-existent.
Michael Seven with KZI has a couple questions. The first is, can you talk more about those new testing guidelines and the benchmark that Dr. Ludke has talked about?
Sure. So the question is from Michael Severn at KZI. He wants to know a little bit more about the new testing guidelines and the benchmark that Dr. Ludke has set around testing. So with the most recent guidelines, the state really doubled down on those at-risk groups and encouraging testing, proactive testing amongst those at-risk groups. And just as a reminder, those really revolve around individuals with pre-existing conditions, individuals who are over 60 years of age, individuals who live in a congregate setting, our unhoused community, and racial and ethnic minorities. And so that group, I believe, we've taken the lead at the county level to start doing some testing. In fact, the training on the people who will be doing the initial phase of that sort of proactive public health testing is happening today. We're looking to have that happen this week. So that's happening. In addition to that, there's some guidance around for providers on who you should be considering for testing. And one of the critical pieces within that is that folks with mild symptoms, who previously have been told to stay at home and then wait for 72 hours after your fever drops or your cough ceases without the aid of medication, that those individuals now should call their provider and have that conversation about testing, knowing that we do have resources in our community to get them tested. So really that's the piece within the guidance that we're trying to double down on. The guidance that I'm referencing actually was rolled out a couple weeks ago, but we're waiting to get our situation, a handle on our situation, and be confident that we have the capacity to really push that. Now we believe we do, so we would like to see our providers order more of those tests. And then the second part of Michael's question was asking about Dr. Ludke's benchmark. And so there's a couple different pieces to that, and once we make that information known and in written form, then I think you can see that out. But one of the pieces is the public health testing. So that's the piece about going around to those at-risk groups and doing some of that proactive, what we call sentinel testing. And that would be around 50 per lab, so 100 total that are dedicated to public health. In addition, what he wants to see happening is 500 tests a day here locally that we are running. So those aren't just for public health, that's the entire community that we are processing 500 tests here locally a day. And we're getting close in that capacity, but what we're not matching on that movement of the capacity expanding is the test being ordered. And that's totally understandable. That's not something that we are saying is a dire situation. We're just starting to see that turn where we're able to be able to test, and we want to encourage our community and our providers to do so.
Second question from Michael. Any idea on the cost of the testing to individual patients, or is that up to providers?
So the second question from Michael is an insurance question. What is the cost of the individual test? So I do believe that most private insurance cover a COVID test with your copay that you would be used to paying. OHP patients is the same course. For people who do not have insurance and work with something like Volunteers in Medicine, Occupy Medical, or even our community health centers of here in Lane County, I believe that we will be working on a case-by-case basis ways to get those individuals tested. But the thought is that no one should be turned away due to cost. And so that would be the rationale at which we're moving forward. But I do believe that most private insurance do cover the cost of a COVID test with their typical copay.
No further questions.
And there are no more questions. Thank you for tuning in.